Hello everyone, Dr. Carlo Ojed, board certified emergency physician with DrER.TV. You are watching ED Video Pro, which is a channel targeted healthcare professionals wanting to learn more about medicine, more specifically emergency medicine. Today we're going to continue our radiologic studies with a clinical case. This is a 22-year-old male. He's a soldier from a troop in Kinmen Island in the Southeast Asia. Presented to the emergency department with a 3-day history of fever, cough, and increasing shortness of breath. His temperature was 101, respiratory rate 32, and oxygen was down to 90%. Physical examination revealed crackles over both lung fields. Crackles are when you hear and a 1 centimeter black crusted shallow ulcer on the middle of the abdomen. This is the chest x-ray. You can see we've been discussing, so you don't have a consolidation. You can still see the right and the left side hard borders. You can still see the costophrenic angle pretty good here. What you do see, however, is just diffuse whiteness over both lung fields. Now, like I said, you still see the hard borders, the costophrenic angles and stuff. So this is not a consolidation, this is a diffuse pneumonia type process. So this is a lesion that was present on the abdomen, a little eschar or black kind of scab. And here's the diagnosis: scrub typhus pneumonitis. Scrub typhus, also known as Tsugamushi disease, is an acute febrile illness caused by the bacterium Orienta Tsugamushi and is characterized by focal and disseminated vasculitis or perivasculitis, potential involving the lungs, heart, liver, and spleen. It's commonly encountered in Asia and the Pacific Islands and is transmitted by the bite of a larval stage mite. The eschar typically forms at the site of the bite and inoculation, but the finding is easily overlooked because we don't search for it and is not always present. Pulmonary involvement is not uncommon, like this patient, often manifests by interstitial pneumonia with bilateral diffuse reticulonodular opacity. So that's the way. Patchy diffuse reticulonodular opacities. That's what we're seeing on that x-ray. Diagnosis of scrub typhus is based on exposure history, clinical features, and serologic testing. It usually lasts 2 to 3 weeks without treatment, and by contrast, patients receiving appropriate antibiotics usually become febrile within 48 hours. Potentially fatal disease. It can kill people. Overall mortality between 6 and 30% in Southeast Asia. This patient was treated with doxycycline, very common old antibiotic, and his fever resolved within 3 days, and he had resolution of abnormalities on the x-rays that followed. So, scrub typhus pneumonitis or pneumonia secondary to scrub typhus caused by the bacteria Orienta Tsugamushi and can be a potentially fatal disease, 6 to 30% mortality. It is caused by a bite of the larval stage mite, and it's easily overlooked, but it causes a characteristic eschar lesion and a diffuse alveolar bilateral pneumonitis or pneumonia. So hopefully you'll learn a lot in this case. I certainly learned doing it. Hopefully you're liking this series, clinical cases, x-rays, rashes and pictures, and we're learning through making these videos. Guys, stay tuned for the next one. Bye bye.